Hello, my name is Daniel Urban. I'm a biologist at the Carl R. Woese Institute for Genomic Biology at the University of Illinois. And we are making this series of videos in order to inform people about COVID and the COVID vaccines. My background, I have a PhD in evolutionary developmental biology, which means I've studied the embryonic development of organisms ranging from humans to bats, the two species that we commonly think of when we're talking about COVID and coronavirus. My biggest concern regarding the vaccine isn't so much the safety, as I'm quite comfortable with that. I've studied this pretty extensively, but more along the lines of getting knowledge about it out to the public and making sure everyone has access and acceptance of that knowledge. The reason why I personally chose to get the vaccine myself is not only to protect me, but to protect my immediate family and the rest of the community at large. I know one of the questions that people are constantly asking these days is, when can we finally relax? Well, the general restrictions that were put into place originally said that we could relax when case counts nationally started falling to about 5 to 10,000 per day. This would be what we see as comparable to average to your seasonal flu rates. For context though, last summer when a lot of these restrictions went into place, case counts were about 20,000 per day. They then spiked over the course of the winter to excess of 250,000 and have since thankfully fallen. However, we're still currently about 40,000 cases per day. So we can't relax just quite yet. Here, very locally in Champaign County, case counts in older populations, 65 plus, have decreased significantly by over 91% since vaccinations began. That's because this is the population that was first eligible for the vaccines, which is great news. However, we do still have a number of cases throughout the county, including about half of our cases currently are being driven by the B.1.1.7 variant. This is one of the variants of the virus that originated in Britain and is highly transmissible. Locally, too, a lot of our cases, about 25%, are being traced back specifically to people going out to bars and restaurants. I'm not saying people can't go out, but just please do keep it in mind and take safety precautions while you are out. How do the variants change the situation? As I've already mentioned, some of the variants like B.1.1.7 are more transmissible, so it's not necessarily going to go away. We still have to worry about this. Furthermore, as more adults become vaccinated, our most susceptible group is actually children who are not eligible for those vaccines yet. So we definitely have to continue to take those safety precautions. School should still certainly be a priority. I know a lot of parents worry about that, but please also think about when they're doing extracurricular activities, whether or not it's necessary, or at least if they're making sure that they're taking necessary precautions while they're out. As far as masking is concerned, I know CDC has recently released guidelines for vaccinated individuals where this isn't much of a concern anymore. However, if you are still unvaccinated, please do keep in mind the 2 out of 3 rule. This is when thinking about whether or not your mask is needed, consider whether or not you're outdoors, your distance, and then whether or not you need a mask. So if you're outdoors and your distance, no mask. If you're outdoors and you're not distance, you do need a mask. And just about any other indoor situation, mask would still be required. One thing I would like to point out about comparisons between COVID is with the annual flu, because very early on, we heard a lot about people trying to compare them to one another, and even with the vaccines. Now, your annual flu vaccine is about 40 to 60% effective because the variants are constantly changing right there, and they can't have a vaccine for every single different one. Whereas the vaccines for COVID are actually highly effective. Almost all of them are well over 90% effective. People usually try to say early in this, and I still hear it occasionally, unfortunately, that there's no difference between COVID and the annual flu. That is not the case. Annual flu deaths are typically around 35,000 per year, whereas in the first year of COVID in the United States, we had well over 500,000 deaths attributed to it. That's more than 15 times deadly than the seasonal flu. And this is just across about every age group, specifically all adult age groups. Yes, older individuals are more susceptible to it, but every single age group has had elevated death risk due to this, much more so than the seasonal flu. The good news is there are 3 really good quality vaccine options out there, and every single one of them is free. There's no cost regardless of your financial or health insurance status, and there are many ways to make an appointment, from national websites for vaccinefinder.org to more local ones through the state of Illinois DPH or here in Champaign County CUPHD. If you have further questions, I encourage you to reach out and contact us, and thank you for your time.